I'm Dr. Gary Nye with Integrative Veterinary Services of Missouri. I've been a traditional veterinarian for over 25 years and now use complementary and alternative veterinary medicine to help your horses. Using primarily chiropractic and acupuncture, we can help a number of different conditions, and I'm going to go through an exam and treatment today on a horse and kind of explain some of the things that I might do while I see your horse. So initially what I'm going to do is take a history with the owner and get any background information or problems they may be seeing in their horse, and then I'm going to have them go through a gait analysis. I'll have them walk them, trot them for me so that I can analyze what's going on, watch the horse move, and I'm going to be looking at the posture of the horse. As I get my hands on them after gait analysis, I'm going to be checking for spinal heat and doing a static palpation over the horse, just looking for initial problems that might key me into certain issues that are going on with him.
What are you checking for, Dr. Nye?
This is just a scan to check for movement in the SI joint initially here, and then I'm going to go down. It's called the hula. I'm going down the thoracic and lumbar spine, just creating a wave motion in the spine so I can scan for movement in the vertebrae, and then I'll motion each of them as I climb up on the bales and get over top of him. I'm putting motion into the SI joint right now. There's two ways to do it, from the ground or on top of them, and do it from the ground here first. And it's a little tight in his pelvis in the SI joint, so I'm going to throw an adjustment in there in a second after he settles down, leans into me. I'm just going over all the joints now, motioning them. There we go. Not a whole lot to talk about right now, Laura. I'm just going through and motioning each of the thoracic and lumbar vertebrae, both straight up and down and then off to an angle a little bit, just so I get all the joints and get them so that they move in the different directions. You got anywhere from 6 to 12 joints on every, or joint surfaces on every vertebrae in the back, so a lot of different directions that they move. There's a few in here I adjusted that were pretty tight. Ribs are good on this side. Thoracics all seem like they're moving pretty well through some adjustments in the pelvis up there. Let's go check the other side. How about that?
So what I'm doing here is called motion palpation, and I'm taking the individual vertebral motion units through their full range of motion and to what's called the elastic barrier. At that point, I'm assessing the quality of the motion and whether that motion unit is fixed or stuck out of place, or the quality of motion just isn't good. And then in some of these, you'll see that I'll throw an adjustment into it, like right there. That was a good adjustment on a upper lumbar vertebral motion unit. I adjust as I go, as I motion them, and the adjustments are a very specific high velocity, low amplitude, yet forceful thrust, and the adjustment is done right at the elastic barrier, right at the extent of the normal range of motion. And this creates a very profound bombardment of the central nervous system with sensory input, and really starts to help normalize that horse's nervous system.
it easy. There. Let's try this one. One thing there, just a little adjustment here coming. There you go. Good job. All right. I can hear him take deep breaths and relax a little bit after that. All right. Let's walk up just a bit. I'm going to flex his neck here and push his mid-cervicals. If he wants to turn his hip away from me, just kind of put a hand on his hip so he won't move that direction. Stiffer to the left. I adjusted him through the mid-cervicals and the lower. On that side I only did the lower. And I see 1 and 2 a little stiff up there, but weren't too bad. He gave after a little bit. On that right side he was wanting to resist a little bit at first. I think he was a little stiff, and he seemed to do better than when I came over to the right side, so I think it probably freed it up just a little bit. But maybe a little stiff down here in the lower cervicals. He didn't want to flex to his left quite as well. Maybe hold it. I'll go over his legs here. Now I'm just working all the joints in the up the leg. Make sure we've got good free movement in all of them, including the sesamoids. You got limited flexion in that purpose. Stiffer in the shoulder, scapula on this side. Throw a little adjustment in there. So. Has he had dental work anytime recently? Or?
Last fall.
Last fall.
He's got overbite. I get this
Does he? Yeah.
every year.
They usually like this pretty well unless they've got a lot of points on their teeth, and then they'll kind of resist it. But this releases a lot of endorphins, and we'll try to finish them off like that and give them a good feeling as we finish up here. Most of his issue was in the pelvis, lower lumbars, and then a couple odds and ends up here in the neck. But other than, well, actually on that left side he was a little stiffer through the mid-cervicals too. I adjusted those, but you know, some stretches on that left carpus up there. And then I think both hind legs seemed a little stiff on the hip area, so I would stretch both of those out at home, and otherwise he ought to be tuned up and good to go for a bit. How often do you get the rope?